Thank you so much. So when I was coming to this venue, Dr. Rama and the rest of the senior was taking me through some other venues to get some introduction on what was happening in the last 3 days. It was so impressive to see that a lot of educational materials, a lot of trainings, and understanding, sharing of experience between among yourself was wonderfully being done. So congratulations to EMSA, Dr. Rama, Dr. Fire, for the wonderful job that you are continuing to do since I met you 8 years, if I'm not mistaken. But when I was coming to this room, I found myself in an odd situation. I realize nowadays doctors don't wear a suit and tie. Like a friend of mine, Dr. Kuzeima, probably next year I will have to change it if I be actually invited as well. So 8 years ago, Rama was actually coming from South Africa, and he was struggling to initiate the EMSA as well, and was also struggling to make sure that THS stand by itself. So we met them as hustler by that time. And maybe this is the reason that he invited me today. When I asked him, why are you inviting me? I'm not a politician. I'm just a physiologist mixed up with public health. I'm not sure where am I. So he just said, you just come and share your story probably, and also talk to our people as well. So before I start my, what we call the closing speech, I want to share my personal experience that make me, coming here, and also it encapsulates what we've been achieved here for 3 days. In 2010, when I was just fresh from intern, I found myself in the middle of, kind of mixed feelings of sadness because I lost one of my relatives. And we were attending this funeral in Tanga, Hande in Tanga. So when the funeral was ongoing, there's a crisis happened at the moment. A young lady actually collapsed suddenly, probably due to intense emotion at the moment, whatever. So there was a lot of panicking going around the venue. The scene. There's a lot of local women were crying. Others were trying to pour water and sponge, this water soaked sponge, she was sponging. And one of the women recognized that I was around. And he called me to intervene in the situation. So when I reached there was like 50 women around that young lady who collapsed. And everyone was shouting. It was like another funeral is going to happen very soon. So due to the situation, I instruct 2 young boys to take the patient to the back of the seat of my car for the intention to drive it to the hospital. But my inner intention was to try to save by doing CPR at the back of the seat, because the chaos will be probably gone by that time. So when the driver was driving to the district hospital, which was about 20 kilometers, I started CPR, and I also instructed someone else, to blow airs in and out, and I was doing the chest compression.